Hi, Karen Damshin with Damshin Financial Planning. Today we're going to do a little combo health insurance and Medicare discussion about drugs. Drugs continue to be one of the biggest questions I get asked on a regular basis. Why is my medication so expensive? Why did it go up? And we have seen some astronomical price increases in medications on insurance plans this year. So I have a few tips of how you can help control some of those drug costs. Number one, if you are not required to use a brand name of a medication and maybe a generic is available, that could be less expensive than the brand name. Not always, but usually. So check with your doctor, see if there's a generic option available. Ask about other options. Perhaps your doctor wrote a prescription for one name of a medication, but there's another name that will do the same thing. So don't for one moment believe that your doctor knows every medication your insurance covers and how it covers. So make sure you advocate for yourself. You can always call your doctor and say, hey, my insurance doesn't cover this one, or it's very expensive. Can we look at a different one and see if it's less expensive? Compare your price across pharmacies. The price you may pay at Walgreens with your insurance could be very different than CVS or Walmart or Safeway or Fry's. Some of these grocery stores use their prescription pharmacies as kind of a loss leader, so you can shop those drug prices around. And it's fairly simple for a pharmacy to transfer your medication to a new pharmacy. You can also take advantage of some of those coupon savings programs, things like GoodRx, where when you're in the pharmacy, they tell you what the price is. You can pull up GoodRx on your phone and see if there is a cheaper price without using your insurance. Just keep in mind, if you don't run the medication through your insurance plan and you pay for it privately out of pocket, it's totally fine to do. But that amount that you paid out of pocket will not be going toward your max out of pocket costs. If you're not on Medicare particularly, and occasionally if you are, there may be some patient assistance programs available. Go home, Google, see if there's an assistance program available for the medication, especially if it's a really expensive one. And no matter what, just make sure you're not skipping important medications. You can also always ask your doctor for samples, especially on some of these really expensive medications. They may have samples that can tide you over for a little bit. So as always, if you have specific questions, please feel free to reach out. I'll be back in your inbox again next week.